Hi guys, my name is Rob Leininger. I'm a physician assistant and functional medicine practitioner, and I wanted to talk to you today about what is functional medicine. So I worked in the traditional medical setting for many years, and I don't have anything bad to say about it, but the reasons that I got into medicine in the first place, I realized there was a set of tools that were being used in traditional Western medicine, and those tools were leaving me a little short of the desired outcomes. Typically, the way that the process works in Western medicine, I'm sure you've all experienced this. You have, let's say, symptoms. It could be headaches or back pain. You go and you see your provider, and what happens? Well, you ultimately end up with a diagnosis, right? This usually occurs over a short office visit. We don't get to spend a whole lot of time with providers. We end up with a diagnosis and then typically a treatment plan. This all makes sense, right? It's what we're used to. It's the medical system into which we've been engendered. But I'm here to tell you there's maybe a different way that you can consider looking at this, something that I've adopted, and I want to tell you why. A lot of traditional Western medicine involves, again, getting this diagnosis and then being given a treatment plan, which in the majority of cases results in you being given a prescription, some sort of a prescription medication that is, that you're going to take, and it's going to help you with those symptoms. So this is sort of the overarching theme, is that it's essentially a system that's set up for symptom management. Okay. Some of us providers, we want to know why. Why are you having those symptoms? What's leading to those symptoms? And we want to dig a little deeper. And this is really where the functional medicine approach, I think, is different. It's novel. It's a new way of doing things, and it's got a lot of different tools in the toolbox that can really help improve patient outcomes. It can help people to learn more about their own body and the way that they work, and help you to ultimately get rid of those underlying causes for the symptoms that you're having, as opposed to just covering up the symptoms with medication. So functional medicine really, by definition, we're looking at the root cause of whether it's musculoskeletal pain, neurological illnesses, metabolic abnormalities, mitochondrial problems, so things that lead to decreased energy, you name it. Really, the problems that we approach are much the same as Western medicine. It's just the fundamental approach that's different. So the beauty of functional medicine is it's really individually tailored to the patient. So it's not following an algorithm as in much of traditional medicine. It's really looking at you on a deeper level. So genetically, biochemically, looking at these pathways that make you, that make you an individual, figuring out where those pathways are optimal and where they're not optimal, and then using those sets of data, the lab tests and such, to find a treatment plan for you that's going to correct things at that root cause and hopefully get rid of those symptoms once and for all. So we have a bevy of different medical tests that are available, everything from blood tests, urine tests. We can test hormones, we can test vitamins and minerals, we can test neurotransmitters, we can test stool, the microbiome, and that's a big part of what we do, is we look for these root causes. Another big tenet of functional medicine is that they really have a focus on the gut. Okay, so the microbiome, the gut in general. We believe that food is medicine, and we always try to correct things with natural causes, things that anybody can do. So food, movement, things like that, as opposed to prescribing medications. So a big emphasis, again, is starting at the level of the gut, finding out what's working for you, what's not. Are you assimilating and digesting foods, or are you not able to take in the nutrients that your body needs to function optimally? So really starting at this basic level of function and well-being, we can learn an awful lot about patients. We can direct and tailor treatments individually to you. And so you're not going to have the same treatment plan as even someone else in your family or your neighbor or your aunt. This is really precision medicine, I like to say, because we have a bunch of really accurate, precise tools to measure how your body is doing, good and bad, and use those tools, and again, use that data to make adjustments to your system. Do we use medications? Do we use supplements? Sure. In certain cases, if we can't correct things without the use of them, then we're more than happy to, as functional medicine providers, to give you supplements. And that's typically where I tend to treat people from, is as opposed to using pharmaceuticals, I like to use supplements to correct those those pathways that may not be functioning optimally. And so, again, we have lots of great tools. We have an individualized approach. We get to spend a lot more time with our patients, really get to know them on a much deeper level than I ever saw when I was working in classical Western medicine. And I do think that this complements the doctor-patient relationship, provider-patient relationship, whatever you want to call it, in a really positive way. And it also empowers patients such that they're able to learn these methods, assimilate them into their own lifestyle, and hopefully they won't need us much anymore. So I hope that helps, and I hope that answers some of your questions. You guys take care.